Morning, selamat pagi. Assalamualaikum warahmatullahi wabarakatuh. Ada. We will be exposed with presentations of 17 modules, discussions, and site visit, how to protecting our health from climate change. Ladies and gentlemen, we are honored to have all of the representatives from WHO Southeast Asia Regional Office, WHO Western Pacific Regional Office, and GIZ today. To initiate this event, I will now ask WHO Western Pacific Regional Office representative, Dr. Nazir Hasan, to give an opening speech. Please to come forward, Dr. Nazir. Dr. Nazir currently is a coordinator of health and the environment of Western Pacific Regional Office. To Dr. Nazir Hasan, please, the time is yours.
Good morning. Before I start in English, I have to, you allow me to speak in bahasa Malaysia atau bahasa Indonesia itu. Pertama saya minta terima kasih kepada Profesor Adi sama dosen-dosen dari Fakultas Kedokteran Universitas Gajah Mada kerana organize function pada minggu ini. Teman-teman, kawan-kawan dari Indonesia, saya asalnya dari Malaysia, tapi rata-rata mereka ingat saya ini dari Jawa Tengah. Pak supir semalam beritahu sama saya bahawa Bapak kan dari Jawa Tengah. Saya kata, saya pikir mungkin nenek moyang dahulunya mungkin dari Jawa Tengah itu. Thank you very much. Terima kasih banyak-banyak di atas hosting function pada pagi ini. Thank you very much, Madam Chair, colleagues from WHO, the experts from GIZ, Ursula. We have also Professor Chris Ibai, very famous, prominent person in climate change and health. Very honored always to see her, very energetic in these areas of work. I've been asked by Pedant Sid Nasir, please limit yourself to 5 minutes, because she knows that when I have the microphone, then it could be more than 5 minutes. So let me limit a few things. I'm very happy to see many of you here in this room. Many of you we have met in the past, when I was in Cambodia, in Laos, in Vietnam. And also our meeting here. So the first time also I met Pak Lutfan, the organizer. Congratulations for this very important meeting. Now there are 2 or 3 messages that I want to put here. I want to start with provocative statement saying that you come here for trouble, not travel, but for trouble, looking for trouble, because climate change and health, it is a very difficult area. If you talk to medical doctors or even in the public health, say climate change, yeah, but there's something, like it's a real challenge to the health people, to the medical people. Climate change is a real issue. So when I say trouble, because the training here is not for you, but for the country. So how can we increase from this? How can we increase the capacity, the understanding of people especially in the health sector, to understand what climate change is? What's the difference between climate change and non-climate change issue with regard to health, for example? What will be the difference? Business as usual compared to the business as usual. So this is also the colleague from our friend from Tuvalu was asking, what can she brings back? And I said, there are something we can discuss here, but the most challenging is that this is not training for you, but to bring back to the country to how can we move further from here. And it's not easy, as I said, because you have diarrhea during the non-climate change issue, but also what will be the added value related to diarrhea, or the issues about water and sanitation. The issues about vector-borne, you have malaria, you have dengue, you have everything related to climate, but how do we see that there is a difference between the impacts because of the climate issue? So this is not only to challenge to us, but also to you people. One thing very clear, because my office is in Manila, in the Philippines. In the Philippines itself, we have disaster, more and more disaster, natural disaster. And they were saying that from the IPCC, all these predictions saying that we are expecting more and more extreme weather events due to climate change. 2014 alone and 2013, at least there were 3 major disasters in the Philippines. Earthquake in Bohol, then a major typhoon in Tacloban, the southern part of the Philippines. Many thousands died, and many more. So for sure that I can feel that this climate change issue is changing the whole situation, the scenario of the way we look into the world. Probably getting more this extreme to the other extreme. So we're expecting more and more people getting additional people died or having disease due to climate change. So the expectation here is very high, because this is going to be the first training. This is the first training between the 2 regions, from Wipro and also from Zero. Forget about the 2 regions. We are not divided just because of having one in Wipro and Zero. We are sharing the same environment, same issue here. So there are so many other training that we have in the past, but that's it. You go back, put the training modules on the shelf, hoping that the books will multiply, whatever. You can't. So the challenge is, when we go back, how can we transfer this issue into the institutional strengthening, into the program itself, on the climate change program, and also some intervention that we need at the country level, and especially health. Because at the end of the day, then they were saying that because we come very late, the health sector in climate change came very late. There are many other sectors came much earlier in terms of reforestation, in terms of coastal zone management, and a few others. The health aspect came very last. And the issues about, for example, like mitigation, what can, say, the health sectors involved in mitigation? We are the receiving part. We are getting the impacts, and so on and so forth. So we are going to discuss this next few days. And I need you. It cannot be from expert alone. We need you to participate. We need your experience. You are equally competent and equally expert to us too. We need your experience at your country. So it cannot be like, oh, so the expert knows everything's under the sky. No, we also want to learn from you. I also want to learn from Zero. What have you done, or things that you observe, like these things in your country. So these are a few things that probably I want to share. My final remark is that thank you very much to Universitas Gadjah Mada. We have a very good friend from this area. His name is Dr. Budiono Santoso. I think he was the lecturer in the faculty, and he was very famous in WHO Wipro in Manila. Dr. Budi, namanya Dr. Budi. And they thought I am another Indonesian. So okay, good. Pak Lutfan, thank you very much, and the others, and all of you again, congratulations and all the best, and enjoy your stay in Jakarta. If you have some dollars spent, finish off. Do your shopping here. Thank you.
Second, ladies and gentlemen, then as the WHO Zero representative, we would like to invite Ms. Payden to give remarks. Please to come forward.
Professor Adik, Vice Dean of the Faculty of Medicine from the Gadjah Mada University. Is this not? My colleagues from WHO headquarters, from Wipro, from Zero, from the country offices, colleagues from GIZ, experts who have helped us with developing the training module. We have 4 of them, and you will know them later in this week. It is a great pleasure for me to be giving a few words of remarks this morning. I would first of all like to welcome you all to this 1 week of training. a bit intensive, but I'm sure you will get a lot from this training session from this week. Before I go into some of the remarks, I would like to thank Gajah Mada University for organizing the venue, the training very well. You can see from all the arrangements that they have made, everything has been very smooth, and we would like to thank you. Without your support, we would not be able to make this event possible. And it was last year we met with the experts. We have 4 experts, and we met with the experts, the donor, in the same room to discuss about the training package. And I'm very happy that within even less than 1 year, we managed to develop the training package, and we are now able to roll it out to you all. So it has been a very great success in developing the training materials with the support from the 4 experts, and also with funding support from GIZ. Without the funding support, we won't be able to make the training modules. So I would like to again thank them for all their support in making this possible. And now we have a group of experts. Nasir had already said that we have Dr. Christy Abbey here. You all must be knowing her. We also have Dr. Catherine Bowen from Australia, Professor He Kwon from Korea, and Dr. Lutfan from the UGM here, who have been instrumental in revising the training modules. And their expertise is available to all of us through this entire week. And most importantly, we have all the practitioners from the 18 countries, which is again very important, because the implementers will let us know what are the issues at the ground level, what works at the ground level, what doesn't work, because many times we become a bit theoretical, and when we apply it, it doesn't work. So I'm sure we will be able to merge all this, the practical experiences as well as theoretical knowledge that we have together to make it into a very meaningful training session this week. And I'm sure with the experiences of all of us, we will be able to take something back to your countries so that you can develop similar training package for your own local needs and roll them out in your countries. And we also do not want to see this as a one-time activity. The training which we are giving here, it is not a one-time activity. We want to see several things happening after that. And not only in terms of providing training at the local level, we also want to institutionalize them with the institutes. For example, when we decided to have this training here in Gajah Mada, it was not just that we liked it, but we had some other reason in mind. Gajah Mada showed some interest to incorporate the training module on climate and health in their curriculum. So we thought it is a great opportunity, and that we should engage with Gajah Mada for that they can take up similar training activities in the future. So that was the reason. And I'm sure there are many other institutes in your countries who are interested to take up such activities. And please try to think about that. And when we, on the 5th day, when we develop action plans, we could come up with some action plans on how we want to take the training forward in a very sustainable way. So kindly think about all these things from now itself. The training modules are also developed in such a way that they can be used as standalone modules. It is 17 modules. You might find it very shocking to absorb everything in 5 days. But it is an opportunity for you to know what each of these modules contain. You don't have to learn everything this week. You have time to learn again more in depth later on. But these modules can be adapted for different target audiences. This week we are mainly focusing on health professionals, program managers for climate and health. We also have few environment health professionals from Indonesia. But later, if you want to have such modules developed for policymakers who do not have time to sit for 3 to 5 days, you can take 1 or 2 modules and have that kind of training for senior policymakers. You can have separate ones adapted for environment, for health. So this is what we are trying to develop. And it is not the final module. The final module will be done only after we get feedback from you. The content-wise, it is very good, but I'm sure we still will get some good feedback from you all. And once we finish this training, we will finalize the modules, and after that, we will then share the modules with all of you so that you can then look at rolling it out at different levels in your countries. So this is what I have to say. Thank you very much for coming to this training, and I really look forward to a very successful week. Thank you very much.
Ladies and gentlemen, dear honorables, dear Professor Asel from Gadjah Mada University, I would like to thank you very much for this opportunity to hold this training here at Gadjah Mada University, and we are really honored that we have again this opportunity to hold trainings here, and we know that everything will be well prepared, and we observe that it has been well prepared. And I would like to thank even for the nice smell in the room. My name is Ursula Schoch. I'm coming from GIZ. This is German Development Cooperation, so to say. It is there is no translation for this. It is Gesellschaft für internationale Zusammenarbeit. Roughly said, it is a company working for international collaboration. What is special about it, that we are commissioned by the German Federal Ministry for Economic Cooperation and Development, and we are not a funding agency. We are giving technical advice. We're doing technical cooperation. The training support to this training was given within the frame of a so-called global program, adaptation to climate change in the health sector. So this program is focusing mainly on the aspect of adaptation. We will hear during the training a lot about the differences between mitigation and adaptation, and that it is a key question to all these debates around the UNFCCC process. Our objectives within our global program is a stronger positioning of health issues in the international debate on adaptation to climate change. So this is one aspect in the program, and the second objective is a higher prioritization at national level, and that is why we are here today. So this is the aim of the whole training, so to say, that you get the opportunity to learn something on this topic, and with what Payden and Nazir already said, is the aim is that further on you will distribute your knowledge within your countries, within your organization, within your ministry, and to the health sector in total. The aim of our program is to lower people's vulnerability to the health impacts of climate change, and I hope that this is also the mandate you take home with you, and to distribute this to your countries, and to act on this at the national level. Finally, this is training is always on building capacities, and this training has been developed for quite some time. There were already modules long time ago from CEARO and WIPRO, and it has already been tested once, but there was the idea that we adapted especially to this to program managers coming from the health sector, from the ministries of health, and it has been a longer process in elaborating, in revising all the modules. So there has been implemented quite a lot of knowledge of work, so to say, and you will see the fruits out of it during this week. But as Payden already said, it is not yet finalized in a way that this is now the final version. We also want to learn now from this group what has to be improved, what has to be perhaps downsized, about teaching methods and so on, So please feel free to give your comments at the end of each day, what you think might be improved, what is good, and what recommendations you can give to us. So I think I just have to wish us that we get good insights to the topic and have altogether an inspiring training. And I just want to mention that the head of the program, I was talking about the adaptation to climate change in the health sector, is Ute Jugert, and she will join us up from Thursday. And my position in this program is I'm the advisor, and one of the advisors. We are it's really a small program, so this is also why we can only act now in this first step to elaborate a training of trainers. But for the further activities, I think this will then be something that has to be organized at national levels and with your own capacities in your countries. I thank you very much, and I'd like to hand over to whom?
Thank you, Ms. Ursula. Please give a round of applause for Mrs. Ursula.
Thank you and congratulations to both regions, CIARO and WIPRO, for working together in these training modules, to GIZ for funding this, and to the different experts that are here today. As you know, I work in WHO also, but HQ in Geneva. So our work is more related to policy and to the theoretical aspect that Peyden was mentioning before. I don't want to say too many things, but from the work that we do in HQ, for us it's evident that the linkage between climate change and health is coming more and more clear now. There's more evidence. For example, just in August, the latest report from WHO on the burden of disease related to climate change was appeared from 2030-2050, and then the estimation is that from 2030 to 2050 there will be an additional 250 deaths per year, and most of these deaths will be caused by diarrhea, malaria, heat stress, and undernutrition. So from this side, we know that the evidence is clear, and then we are trying to support countries from that level to make sure that there's an adequate response, to make sure that the health and the public health system is resilient to climate change. Also, from the work that we do in Geneva, we are very linked and very on the top of the policy. So for us, 2015 is a critical year, because at this level there will be two different processes that are going to determine what is going to happen at country and regional level. One is the UNFCCC. You will see in one of the modules that the United Nations Framework Convention of Climate Change is the main, let's say, governing body or UN organism that bring together all countries to make sure that there's an agreement on climate change. So this year in Paris, in November, December, it is expected that there will be an international agreement that will determine how countries are going to work to mitigate climate change. But it will also decide how much money, for example, is going to be available for countries to work on adaptation. So this is very important for us working on climate change and health, because it will determine what we can do realistically at country level also, and which funds are available for us to make sure that we do that. And also there's another very important process, that is the SDGs, the Sustainable Development Goals. And this year also countries will come together and will decide which are the main priorities on development for us to work. As you know, again, that has huge implications for countries, because it also will determine what developed countries, which funds they put together and for which strategic areas. So we are expecting that also environmental health or climate change and health will be under those priorities. So thank you for being here. I'm very happy to be part of this training, and I'm sure I will learn a lot from all of you. So all the best for these 5 days of training.
Thank you. Good morning. Assalamualaikum warahmatullahi wabarakatuh. Our honorable guests, representatives from WEPRO, Dr. Nasir Hasan. I do agree that you look like from Central Java, if not Yogyakarta. A representative from CRO, Ms. Hayden. Representative from German Corporation, GIZ, Ms. Ursula Skop. And then Ms. Elena, where are you? Yeah, you're there. Ms. Elena Villalobos-Prats from WHO headquarters. And we also have representatives from Indonesia, from the Ministry of Health, from the KLH, Ministry of Environment. And here with us, we also have our director from the Sarjito Hospital. This is our main teaching hospital of the Faculty of Medicine. So welcome to you all to Yogyakarta and to Universitas Gadjah Mada. The Dean of Faculty of Medicine, Professor Teguh Haryandono, sent a very warm regards. Unfortunately, today he has to undergo dental surgery, and we all know how painful it is when we have problems with the teeth. So, apologize that he is not with us today. In this special occasion, we feel very honored. And we'd like to thank all the partners for giving the trust to us to host this very important workshop. And I understand that this is the second occasion after last year's workshop, also perhaps happening in the same room. Yes. So in this room is very important for the initiative on climate change and health. Yeah. For those of you who have not been in Universitas Gadjah Mada. Universitas Gadjah Mada is a public university. It's the largest and the oldest university in Indonesia, and it has 18 faculties, so it's a comprehensive university in Indonesia. And particularly this Faculty of Medicine, we are home to more than 6,000 students, undergraduate and graduate program. And I'd like to mention that for the graduate program, the biggest program we have is in public health. So indeed, this meeting is very important for us. And also since 2 years ago, we initiated this partnership with 5 universities in Indonesia, and we call ourselves Inter-University Consortium for Global Health. And this is also in collaboration with Germany, with Heidelberg as our leading partner. So we'd like to thank that the participants also from 5 universities are allowed to be in this workshop. This training, I think it's very, very timely. This morning, coincidentally, my daughter asked me a very serious questions with very serious expression. And she asked me, "Mom, is it true that there is a flood and snow in Mecca?" I wasn't able to give an answer, but then, oh, what a question. And I think the awareness is there, and that's why I think we need to really have health professionals and public health professionals also, because we have medicine, nutrition, and nursing. Also, I think this issue is very relevant for them. Thank you for the experts and the trainees, Professor Christy, Abi, and the team. And we trust you that this training will be enjoyable, will be fun, and at the same time, of course, beneficial for all the participants. We do hope that the collaboration would go beyond this workshop. Ms. Payden already mentioned about the curriculum, and I immediately have a thought of what a wonderful opportunity that we have all the experts here. Perhaps you could spare 5 minutes on the video to give messages for our medical students, nursing and nutrition, also public health students, who are here. So I don't know if that's possible, but this is one of very practical, for us it's practical, but for you perhaps it's already a very high, very intensive workshop. But let's see, and hopefully it's possible to do that. And to the participants, well, enjoy the training, and I believe that you will make the most out of it. I do apologize that with 52 participants from, I was counting this morning, I think it's more than 20 countries in this room. Perhaps you feel that the room is a little bit tight for 52 participants. However, we still keep the dancing floor here. So in case the trainers would like to do something fun, so we still have a little space, and of course a lot of space outside the building. Yeah. Yeah, looking at the schedule, yes, indeed, it's an intensive workshop, but we all hope that you could also enjoy Yogyakarta and spend your dollars on buying batiks. So this is the examples. You are in the place where this is the city of batik in the world. So please do that successfully also, in addition to the training. And last but not least, thank you to the organizer, Pa Lutfan, and the steering committees. I think they've been working very hard, and without them, I think this workshop would also have been impossible. So with this, I'd like to formally open this bi-regional workshop on climate change and health, protecting our health for climate change. So thank you. Assalamualaikum warahmatullahi wabarakatuh.
Assalamualaikum.
Pamirsa, tipayun urang kantos ngadangkeun suanten Ibu Haji Ijah Hadijah dina lagu Serat Salira sareng Walaran Salira. Ayeuna sumangga nyangakeun lagu ciptaan Anom Gugum Gumira dina judul lagu
kiat durian nu ngembang begat ibarat ngalindu tepuguh nu dibantun kitu lepat kieu lepat Sigano pegat sapa Zawarna Bade satya ngajadi kamu disin tanah gening kembang wera pabenta salamina
mari makan
hujan darda bang tunggara halo sarano tapi
mari makan apa pulang arek kiri sisi ngawulang kena kadar dibarengan hati sama kurang mangkar malis sesam dewasa nulungai kenangan dewasa nulungai kenangan
bisa dapuku kiat durian ngembat pegat-pegat ibarat ngalindur tepuguh nu dibantun kitu lepat kieu lepat jigan pegat sawarna bade satya ngajagi kamu disin tanah gening kembang wera papensa salalama hujan soka darga kembang tunggara halo
Thank you very much. Please give round of applause for Yana Nofrita and Enang Setianingsih.